Hey, Jeff Moody here, Jeff Moody MD, jeffmoodymd.com, jeffmoody.com for the weekly video burnout tips for burnout breakthrough and burnout recovery for you. What I would love to talk about today is the business case for treating burnout. And so imagine today what I'm going to do is put on my heartless hospital administrator hat, which I know that's really far from the truth, but I think sometimes physicians will perceive that administrators of healthcare systems don't really have maybe physicians' best interests, but they're really most concerned about how productive physicians can be for them. So let's put on the business-only hat for just 2 minutes here and talk about the business case for treating burnout. So, excuse me, if for example, a burned out physician leaves, it will cost a hospital system $500,000 to maybe $1 million to $2 million to replace that physician. That amount of money will pay for lots of scribes and lots of call and lots of help for physicians. That's an unbelievable amount of money that's lost. Physician productivity is reduced when they're burned out. Some would say 10 to 50%. Physicians will be much more likely to move to part-time employment if they are burned out. That's been shown a number of times in different studies, and that is obviously a risk factor for less productivity. I think what physicians are actually doing is titrating their exposure to the things that are burning them out, and they feel like if they are less exposed to work, they'll be less burned out. And that actually may work, but it doesn't change any of their own personal issues related to burnout or any of the systemic issues. It just gives them less exposure. So that's clearly an economic issue. There are risk issues that are associated with burnout that can be expensive. For example, malpractice risk goes up. Some even quantitate it to 4% increased risk of malpractice for every night someone is on call. There are hospital risks for patients from a care standpoint. There are studies that show increased rate of death in patients who are cared for by burned out doctors. So if you strictly look at the business case for treating burnout, it's overwhelming that number one, it should be done, and number two, it's very cost effective. So even if your system or your employer does not like you, it makes only financial sense for them to get your burnout diagnosed, treated, and get you recovered, because then you will be more productive. And if there's the bonus that they actually like you and you like them, then it works out even better for everybody. So if you like these video tips, come on over to jeffmoody.com, sign up for my weekly email list so you don't miss any of these. Head on over to YouTube, and Jeff Moody MD will get you to my live stream, which is a regular interview type setting with important players in the burnout space and really around the world who have great perspective on their fields and how they relate to burnout. Check out my book, The Doctor is Burned Out, A Physician's Guide to Recovery by Jeff Moody MD, and our course, Burnout Recovery for You. That's all available at jeffmoody.com. Love to see you there. Please access those services as you need them, okay? We're here to serve you. So please do that, and remember, burnout recovery is for you.